All right, let's continue now with the reaction to the State of the Nation address. President Cyril Ramamphosa says the vaccine rollout plan will be outlined in the coming days. But for more, I'm joined now by Abeedah Adams from the People's Vaccine Campaign. Ms. Adams, thank you so much for your time. Are you satisfied with what the President had to say? I mean, we're looking at the stats. Over 47,000 people have died. COVID-19 active cases continue in the country. Was there a sense of urgency coming from the President last night, in your opinion?
Hi, good morning to Melo. Thanks for having me. No, we are not satisfied at all. In fact, I think it was an extreme letdown, very disappointing, very little facts, a few mentions about vaccines, not enough detail, nothing about how it's going to be financed, scant information around the actual rollout plan. He said, for example, that we're going to get 80,000 dosages of the Johnson & Johnson vaccine in the next week or so. But still, no, that would probably be for the frontline workers, the healthcare workers. But in the initial plan, they said there's 1.25 million healthcare workers that must be vaccinated. Now, 80,000 dosages. I mean, it's not. I think it's about 10% of that targeted community. And then we hear that Johnson & Johnson vaccine vaccines, we're going to get, I think, another 500,000 in the next 4 months, which means by the end of March, we will have 580,000. But that would mean that about almost 50% of health workers would then be able to be vaccinated. But no detail, absolutely no detail. And also, we still don't know, with regards to cost, which is a big issue for us.
Yeah, it seems the President, Abeedah, if you could just come in there, is making promises around commitments, from Pfizer to deliver at least 20 million doses, COVAX, 12 million doses of the vaccines as well. Then obviously that Johnson & Johnson, doses totaling 9 million. I mean, yes, we didn't really see details, but what are the consequences of this if there isn't urgency from the President nor Cabinet to ensure that healthcare workers, those prioritized such as the elderly, those with comorbidities, are attended to with urgency? What warning are you giving the President about this?
Look, we're already sitting up. Now that we've kind of reached the end of our second wave, we know that if we are going to carry on in this way, the third wave and probably a fourth wave is inevitable. So really we do need urgency from the President, we need urgency from the Department of Health, but we also need to know what is happening in terms of the Ministerial Advisory Council, because part of the problem is also in terms of the vaccine rollout plan, we do not have real and genuine participation of civil society. There's also no oversight, and we know what is going to happen. There's billions of rands at stake here. The amount that we hear from government is 20 billion for the vaccine rollout plan. From our side, the health economists and the health professionals and the experts, they are saying we only need 10 billion. So we do need civilian participation, participation of civil society, but also oversight, because that's issues we cannot afford to even squander another cent. We still have not resolved the issue of the 500, whatever the amount is that was spent or that was spent on PPEs. So we're saying to the President and we're saying to government that there is not enough seriousness. There is still no, we've heard recently that there are 200 points to deliver the vaccines and for people to access it, for the healthcare workers. That would mean in some cases that a healthcare worker would have to travel 200 kilometers to get a vaccine.
Right.
That cannot be. That is absolutely unacceptable.
When we talk about commercial interests here, how important is it for government, particularly the President, to have been transparent around commercial interests which had play here, especially when we're talking about procuring this vaccine?
Look, our position has been very clear on that. We are saying that vaccine is a public good. And, there's also, and I think also that contributing to the vaccine hesitancy is the issue about how big pharmaceutical companies and other in the industry or in the logistic plan in terms of the vaccine rollout is going to benefit financially. So really, we don't want profiteering of this vaccine in all levels, whether it is locally in South Africa and even internationally with the big pharmaceutical companies. That is why we also need to know how much are we paying, Are all the countries paying the same? Why are we paying more for dosages than other countries? What is the amount that we are paying, for example, through COVAX? Is it all the same? So those are issues that is at play. And, we are sitting in a country where we've got so much, we're the most unequal country in the world. And really, we should not just be spending money. There's an emergency, there's a vaccine, that we need the vaccine, but we also need to have a level of responsibility with the money, because this is our people's money that we are going to ultimately spend on the vaccine. So it's important for us to have transparency. There's all these things about non-disclosure agreements because of the financial interest and all this kind of thing. And we cannot operate in this kind of silence and no declaration in terms of where the money is spent and how it is spent.
Ms. Adams, we'll leave it there, but thank you so much for your contribution to this conversation. Abeedah Adams for, of course, an organization advocating for vaccines.